Welcome back to Medical Morons. We hope you are having an amazing Monday. Today's episode will be a continuation from our last episode. If you haven't listened to part 1 with Dr. Layne yet, go back, start there. I promise it is worth it. Part 1 was a little more educational. We introduced why airway has become such a hot topic in medicine and dentistry, the consequences of untreated sleep apnea, what contributes to it, and why so many people are walking around completely unaware they have it. We also got into why dentists are uniquely positioned to be the ones catching it. So in part 2, we get into the practical stuff, what his concierge practice actually looks like, the sleep hygiene habits that matter most, what treatment looks like for patients, and how doctors can start incorporating sleep into their everyday practice. It's a good one. You don't want to miss it. So, Dr. Layne Martin, welcome back to Medical Morons. And what if my dad and I were to be your patients? Like, can you talk to us? You're a concierge doctor. Like, you come to people's homes. Can you tell us, like, if someone was interested, or from a patient and a doctor's perspective, what that whole process looks like?
So I moved to Florida 5 months ago, and where I am is very underserved for what I do, and kind of what a lot of the people on this call are doing. So I am in my office Monday, Thursday, Friday, and it's just word of mouth. And I joined a networking group, and now like I'm really busy. I also got attached to an amazing concierge medical group because sleep testing is really easy. People don't need a functional MRI. They don't need this type of extensive blood work. Someone comes in with the comorbidities like we were talking about, you sleep test them. You give them this thing on their finger and you see their numbers. So if I go to someone's home, I have a scanner that I love. I've used every scanner on the market. Right now I have an Allied Star scanner. It was really cost effective. I have my laptop and I go to someone's home. I sit with them. I ask them a lot of questions around sleep, some of their comorbidities. I scan them, and a week later I go to their home and I give them the mouthpiece. And then I also fit them with our pillow. The nice thing about the pillow now, it's adjustable. So I could take fill out of it and I could add fill to it. So the problem with our first run of the pillow, we sold 1,000. We had 8 returns, all women. The problem was I had the head part of the pillow propped up because I was concerned as an airway person. What if someone lied on their back? Their tongue would fall back. But the problem is ear to shoulder distance is different in men and women. And so 8 women were the ones that returned the pillow.
So interesting.
Yeah, so now we flattened it out. So the head part's really flat, and you could just add to it if need be.
And then what about from the patient's perspective, next step? So let's say, so they do a sleep test, and then depending on their oxygen levels and other kind of data points, you determine if it's just a mouth guard they need or they need the sleep appliance.
That's a great point. As a dentist, I can't diagnose someone with sleep apnea. My physician, I could in the state of Florida, I could hand someone a sleep test. In New York, you cannot do that. Mm-hmm. So I had a company that was just shipping it to the patient, and the physician gives you a letter of medical necessity and a diagnosis. So now if someone's mild to moderate sleep apnea, they could use an oral device, what's called a mandibular advancement device, or a mouthpiece. If it's more severe, their patient's going to want to be started on CPAP, which is the face mask. The nice thing about our device, so when I go talk to a physician, I never walk in and say, hey, I have a device to replace CPAP. I actually have a device that they could wear with CPAP because this prevents their jaw from falling back. It's the same thing. I'm going to say something super controversial. You should never make a single arch night guard for a patient ever again. And like people go crazy when I say that, but it's the same concept of CPAP because your jaw could fall back. Upper is worse because it takes up tongue space. And when your lower jaw hits an upper flat plate night guard, it goes back. Lower is better, but the same thing that can happen, your jaw could rotate clockwise. So our night guard, upper lower, is what every dentist should be doing for any patient that's clenching and grinding. And actually any patient that you see post-ortho should get an upper lower our night guard.
Incredible.
So are you saying that even if you don't have any of the comorbidities that you identified, that everyone should consider using a mouth guard when they sleep? I mean, is it that kind of a situation?
I love that question. So I'm 53 years old. I'm a military veteran. I played every sport. I work out 6 days a week. I snore. I don't have sleep apnea. I have what's called upper airway resistance syndrome. What happens is the back of my throat doesn't work the same way that when I was 30. So I would argue anyone over the age of 35 or 40 the back of their throat is not going to work the same way. When you sleep
Over
at night,
30? I'm now in the old group. This is so sad.
no, I didn't say old. I said the airway might not work the same way.
Oh
I
God.
said 35.
Okay,
I said
okay.
35.
I got some time.
That's all right. I'm going to probably take a lot of heat from all these
No,
statements.
it's good. People need to,
You
it'll
know
wake
what?
people up.
I've never been a disruptor, and like my business partner is like the biggest disruptor. It's awesome. It's kind of fun to be a disruptor.
Yeah.
Getting back to your point, if you go to sleep at night, what happens is you get what's called muscle atonia. So the muscles in your body relax, especially when you get into the REM part of sleep. So if you think about it, when you get into the dream part of sleep, your whole body's paralyzed except for your diaphragm, or else you'd act out your dreams. So if you're in the dream part of sleeping, you're lying on your back and your tongue falls back, your oxygen's probably your oxygen level is gonna go down. The premise of sleeping with our device, your jaw can never really fall back. So I think it's not just for people with snoring and sleep apnea, it's anyone that just wants to sleep better.
So even if if you don't have apnea, but if you're not getting as much oxygen while you're sleeping, like we don't have to get too geeky about it, but like why should people be concerned about getting enough oxygen while they're sleeping? You know, if they think like I'm fine, I sleep fine, like everything's fine, like what could be happening kind of chronically if you're not going to correct that?
So the question I always ask when I'm going around lecturing, the first question I always ask is, are you aware that you snore? I never ask someone if they snore because it's still somewhat accusatory. So I'm like, are you aware that you snore? And when no one raises their hand, I'm like, you're all full of crap. Like a lot of the people in the room should be raising their hand. The second question I ask is, who in the room slept 7 or 8 hours, woke up feeling like they can go run a marathon? No one raises their hand because our society, we're so accepting of sleeping like crap. Or it used to be like, oh, don't worry, I could power through it and just sleep. But now if you look at athletes, Tom Brady, Dak Prescott, LeBron, they're all talking about sleep. And it's not even they're talking about performance. They're talking about recovery because there's a stage of sleep before REM. That's where we recover. So in kids, that's where they produce growth hormone. In adults, it's recovery. So I'll give you an example. I was 5'2" up until 12th grade of high school. I was tiny. I'm 5'11" now. But when you in ortho or in general, if you have a 12-year-old and they look like they're 6, they're probably not producing growth hormone. They're not getting into that stage of sleep. And in adults, that's the recovery. That's the brain fog. So my partner, Michael, he's always talking about brain. So when we get up there and we're talking about orthodontics being like, it has nothing to do with teeth, everyone's like, oh my God, what are you talking about? It's about brain development. If you think about it, your brain is almost fully developed by the age of 5. We should be treating a lot of kids early. And then in the adult part, it's the Alzheimer's, dementia. So it's not just, yes, you're going to feel better, but it's also a big part of like brain, because in your brain, Michael, the other part that happens is we have our lymphatic system. Well, in your brain, you have what's called the glymphatic system. And if you don't get into that stage of sleep where it can kind of get rid of the toxins in your brain, that's the brain fog, the Alzheimer's, the dementia.
All right. I kind of want to grill you now on some stuff. This is not because I'm skeptical. It's because I know what people are thinking. They're going to be fighting back. And so I want to kind of debunk any of these, thoughts right out the gate. Putting your jaw forward, right? The thought or concern for a lot of people is your condyles, which is, sorry, we're getting a little niche, Dad, but the part of your jaw joint is going to be now displaced a little bit while you sleep, in theory. And then it could start remodeling, and then it could change your bite and all these kinds of things that might show up later long term. What do you say to that? Is it going to be, are we going to see condyles remodeling? Like, is that something you're concerned with or looking for?
I actually think it's the opposite issue. So my partner and his dad, who the device is named after them, it's a lower gelb. If you think about it, like when I first saw it, and I think a lot of people in dentistry are skeptical of what Michael's done. I've heard it before, my partners were. But when I got to his office, I realized what he's done with his lower repositioner is what we would do in ortho to get someone's mandible forward with like a functional ortho appliance. So actually, it's the opposite. If someone's skeletal class 2, what's happening? Their condyles pounding back on that retrodiscal tissue. So many of the patients that have class 2, guess what? They have ear issues. I always pull up an image of a TMJ and you can see how thin that bone is between the ear canal and the fossa. So actually that position that Michael and his father developed, that GELB 4-7, when they say they take a phonetic bite, it really makes sense. Yes, could it, if you put someone that's, they're 75% of their protrusive bite and you leave them there, are they going to necessarily remodel? What's going to happen is it's not that their bite changes, their mandible repositions, and yes, their muscles can remodel there. The nice thing about our device is I can get into my centric occlusion bite, my habitual bite with our appliance. What happened was we just refiled our patent saying like our device is biomechanically auto-titratable. So what I said before about someone doing CPR on themselves, our device allows them to do that. So I'm not necessarily pulling someone out of the fossa. I'm just allowing them to kind of titrate themselves.
What
I
do
know
you
that
mean
was a very yeah.
No, I guess I'm
Sorry,
just
go
kind of
ahead.
confused by the titration. You're saying that it's not fixed. It's the upper and lower are not locked into place, so that there is some
They're not.
shifting. So
So
is it just preventing it from going backwards rather than like shoving your lower jaw forward? Is that kind of the idea?
it's exactly that. So what happens now with our device is they can get in their normal bite. If they have any type of oxygen desat or their airway gets closed, they do this to themselves and then they can come back to their bite. So
I
I am not anchoring anyone forward anymore. I used to, and then I was seeing not necessarily issues with condyle or significant TMJ. I was definitely seeing bite changes.
Interesting. So, and now you're seeing less bite changes with your device.
We're not seeing any bite changes with ours.
Amazing. Because I think that's what a lot of dentists would be nervous about by, using your devices, not yours, just any type of sleep device without having enough background on this is like, okay, now 2 years go by and I'm screwed and I have to deal with this whole mess. Okay. This one's not really grilling. I'm just curious as an orthodontist. MARPE is another, I feel like orthodontists for some reason, maybe just because it's in our curriculum, are more comfortable with MARPEs for sleep apnea than they are these devices. I'm not saying it's right. It's just like we study it for boards. We study a little bit on these devices, but not much. I personally find like I would rather have sleep apnea than get a MARPE for myself. Like that just sounds dad. A MARPE, you're gonna like vomit if you hear what this is. There's a place and a time for sure. I'm not disagreeing with MARPEs, but as a patient, we basically, a palate expander. I had one as a child. I'm sure you were very involved with that portion of my life. But we screw in with mini screws. We screw them into the roof of your mouth with this like metal appliance, and then we put a key and crank the suture apart of your upper jaw so it breaks your jaw or your bone a little bit, and you do it like every day or whatever the prescription is.
Why? Why do you do that?
So it's for people who have a really narrow palate and you need to like widen them more. And so the thought is that for patients with sleep apnea, if they don't have nasal patency, then by opening the palate, which is connected to the nose, that you have more airway and less constriction. There's more space for your tongue. Like there's all these things that it can help. But to your face, I don't recommend that for people who are in mild sleep apnea and just want to sleep better. And then you have a major gap between your front teeth. Wouldn't be okay with that either. Like it's not a pleasant experience. Let's put it that way. Unless it's an emergency, like it's not my first choice. So what do you, as the expert, Dr. Layne Martin, what do you have to say about MARPEs?
I actually think there is a place for it. I definitely need one myself because I have a high vaulted palate. And I think I always say the roof of your mouth is the floor of your nose. So it also starts with nasal patency. That being said, I think someone with severe sleep apnea, someone that's really skeletal class 2, that you don't think you can get their mandible in a better spot, I think orthodontic surgery is amazing for some of those patients. I think if someone's really high vaulted, I think MARPE, there is a place for it. I believe orthodontics in the right hands, even in general dentists that are doing really good Invisalign, as long as you upright molars, you increase vertical, you give someone more tongue space. I don't care what you use, as long as you make someone wider and you bring them forward. I'm kind of agnostic on the ortho piece, to be honest. I think there's, it's really a tool, and it's like anything. This is fixing a symptom. This is not fixing a problem. So I always say, what do you do with a 30-year-old? Because the issue is I go to all these sleep courses and these meetings, and there's people walking around and they're like, look how great I am. And I'm like, yeah, that's great. What do you do with a 30-year-old? I can't hand this to a 30-year-old and be like, here, wear this for 60 years. That's crappy medicine or crappy dentistry. But the beauty in dentistry, what could you do? Ortho, you could upright molars. You can give someone more tongue space where, yes, they're going to need retainers forever, but they don't need it to be functional like this. Or someone doesn't want ortho. Restorative dentistry, put someone's bite in a better position, build up their posterior teeth with onlays or crowns. There's a lot you can do with dentistry to help this medical problem. I always defer. I love ortho as my frontline defense. People are not always going to want to do it. Restorative dentistry also solves a lot of those problems as well, getting the mandible, the lower jaw to the back of the throat, moving it forward and getting the tongue out of there.
Totally. Okay, I think this is my last grilling question. What about patients who, they're not expensive relative to other things, but it's a lot of money to be paying. So what if it doesn't work as well as they're expecting? How do you combat that? Do they just say, I'm still waking up tired? Like when have there been kind of times where you're like, oh shit, there was trouble in paradise?
I look at it different. I handle sleep as like precision medicine. So what do we talk about in medicine? Evidence-based, but it's really evidence-informed. So each patient is different. I look at their sleep test. I look in their mouth. I have them sit back. I look where their tongue sits. I look if they can breathe through their nose. So every single patient I see, mouthpiece, pillow, nasal patency protocol. I work with a lot of speech and language pathologists on inspiratory, expiratory training. So I have a really hard time with someone that's not doing well with sleep. And I do follow-up testing because I want to figure out like what's not working for them. And you brought up something really important. I've trained a lot of dentists on this, and I hear some crazy numbers of what people charge. And I'm talking upwards of like $7,000, $8,000. And I think that's so excessive. I do. And I'm opinionated on it because it's access to care. And I charge in my office I take insurance. I'm in network now with Medicare in Florida because I wanted to create access to care. My cash fee in my office is $19.95. I'm probably the lowest in South Florida for it. And if someone can't afford it, I'm still going to do it. And whatever they could pay, they pay.
Do you recommend that everybody like over a certain age get a sleep assessment, or only if you're presenting, a set of symptoms? Like,
I love having everyone get sleep tested at their physical. I think it's so easy. I think it's so accessible now. I think in a year, your Apple Watch will probably be FDA cleared to do a sleep test. And I love getting a sleep test because it really shows me what's happening in the middle of the night. It's not what's happening during the day. It's what's going on at night. Are you suffering from issues like brain fog? Are you having to get up a lot? Are you tired all the time? So I would test everyone. I think it should be part of a physical. It's super inexpensive.
Like blood work, yeah.
It's super easy. And you just sleep in your own bed with it.
Let's do it, Dad.
and how many nights of sleep do you test?
So I was testing one night, and the problem is I was getting a lot of false negatives. And I would also have people that were biased where they were like, they're drinkers and they're like, oh, I'm not going to drink tonight. And then I'm like, no, whatever you do normally, I want you to do. So right now I get a baseline normally of 2 to 3 nights. I test them. My physician reads the test. They give me a diagnosis. I give the patient the adjuncts that I use, and then I follow up test them probably 6 to 8 weeks later with all the different adjuncts. So if someone's on CPAP, I test them there. If I made them a device and they use their CPAP, I test them that way. I give them a pillow. So I love to look at the data to make sure what Kylie said, is it working? Because if it's not working, it's going to bother me. I want to get those people better. And a lot of it is subjective. So I'm always following up with patients, especially after the first 2 nights of them using our device. I'm like, you know what, Mrs. Jones, how did you sleep? Did you notice any like jaw tenderness? Sometimes people might get a little bit tender from having their jaw get pulled forward all night.
It's so cool. And it's like exciting me, and it makes me want to figure out how to incorporate this into my career. So if I'm working at a practice, if there's general dentists, do they have to be in Florida to use Airvada? How would that process work if someone's looking to kind of increase revenue and help their patients directly to the source?
So I've trained a lot of dentists, and I think now we've really simplified it. You could use it anywhere. We're countrywide. if anyone wants to reach out to me, I can give you my cell phone. If you want me to give my cell phone, you could share my email with all your listeners. I'm really more than happy to jump on. I love sharing what I know. I think I'm passionate about the space because I missed it for a long time. And I think that being able to, teach dentists, I love that. I love teaching. I love sharing kind of what I know is really fun. So
Awesome.
anyone could use Airbata. We have an amazing team.
It's interesting to me that you haven't talked at all about like what I hear referred to as sleep hygiene, and good nighttime habits. What's your take on that? Including what I love is my late afternoon nap, like at about an hour from now. Is that something that's a good idea? Is it a bad idea?
I talk about, and I'm glad you brought it up. I talk to every patient about sleep hygiene. My partner on the pillow was with a startup called Tuft and Needle, and he coaches CEOs and celebrities on sleep. So we always talk about sleep hygiene, but the most important things about sleep hygiene are going to bed and waking up the same time every day, regularity. You hear Matthew Walker, he's a big sleep scientist, talk about it. Temperature, super important. So set the temperature at about 68 degrees, which is cool. And then you want to wake up with it a couple of degrees warmer. The other thing is like someone like Andrew Huberman talks about resetting your circadian rhythm. So when you wake up in the morning, get outside, look at the sun. In terms of naps, I do like naps. It just can't be more than like 20 or 30 minutes. So there's a company right now that I just met, one of the CEOs called Newcom. They have like resonance around music, that they have different things. They have like a sleep suite. They have one for naps. And I'm actually going to start implementing one of that as an adjunct for a lot of my patients, because a lot of my patients, they just want like quick and easy. I love what's called myofunctional therapy, which is kind of physical therapy for tongue, oral muscles. A lot of my patients don't want to do that. I always want them to do that because I think it's such a huge part of someone that has a sleep issue. But I love sleep hygiene. I should have brought that up before. I'm sorry.
I'm sorry. You guys got into a deep clinical conversation, so I was just
yeah.
I wanted something I could contribute to. So
and you know what? And the sleep hygiene thing is so important, Michael. Like I work with a lot of physicians that are always talking about sleep hygiene. And like our chief medical officer for the pillow, his name's Shane Criato. He's a psychiatrist that works with Amen clinics. So I don't know if you've ever watched TV late at night. There's Daniel Layman talks a lot about Alzheimer's, and they have an amazing supplement I give to every patient. So I also give a supplement that has L-theanine, ashwagandha, GABA, magnesium, right? Because a lot of people come in and they're taking tons of melatonin. Well, you got to be careful with that because your body produces melatonin and sometimes it could like deregulate.
Yeah, I hate melatonin.
So I could talk for 10 hours on this.
Yeah, it's so interesting because everyone cares so much about their sleep. And I just want to make sure people are clear. Like dentists, my friends, if you're listening, they can sell your products at their practices, right? They can scan and submit it through like a virtual portal and deliver the care that you guys are figuring it out, right?
Absolutely. And if someone doesn't know a lot about sleep or they want to learn, feel free to reach out. I jump on with as much as I could have time throughout my day. I was just on with the dentist right before this. A lot of times I'll just jump on a Zoom with them. I'll show them our devices. I'll show them, I'll help kind of troubleshoot some stuff with them. Because that was really what it was. It's got to be more than just the 3,000 dentists that went through the AADSM program. It's every single dentist that's making a night guard. That's really what it is.
Which they all are. I love it. Okay, last question. We always end the episode with a funny story that has happened from either your education and your career. Patient facing is kind of a common one from people.
I have a funny thing that happened. It was someone that I met the other day at a book signing, and I was talking to the patient that's coming in right after this. He is a huge public speaker, and he's like, "Oh my God, dude, you got to fix my snoring." And he was like going crazy. And I'm like, sure. But he's like, wait, my friend has an app that you have to look at. The guy's name is Ryan and his last name is Layne, Layne. which is how I spell my first name. So I get on the phone with him. We're on a Zoom like this, and I'm looking at the spelling of his name. I'm like, by the way, like, is that a family name? And he's like, actually, my grandfather played professional football, and he's in the Hall of Fame. His name is Bobby Layne. And I'm sitting there laughing, and he's like, what? I'm like, actually, I'm named after your grandfather. And he's
No
like,
way.
shut up. Yep, my dad was a football fan. I'm Jewish. I needed to be named after an L. And that was how I got my name. And now we're working with the guy, and I'm like, all right, this is a sign from God.
That's
So it's
really
not a dental
funny.
story, but it's like, it was the craziest thing that happened the other day, because now he also works with the government. And I'm trying to get my pillow in, as a veteran. That's something that's very near and dear to my heart, because I always say, like, the military allows us to sleep well every night. We really need to allow them the same luxury, and it's super important.
100%. I love that. Well, it sounds like, I mean, your mission is so clear and meant to really just help as many people as you can, which I think is a really cool thing. And the fact that you're able to do a career that you enjoy and can make a living out of, I think is kind of the goal for all of us, right? And I think people can lose sight of that in dentistry because it is tedious in other professions too. I really hope people take that away from this episode as well, and we can start helping people sleep better. Where can people find you? I know, like, where can they reach out to you? Website, like how can they start?
Yeah, so they could go to airvada.com is our mouthpiece company. Open Air Pillow is our pillow company. Could I share my cell number?
If you want, yeah. Careful. You're very popular.
I'm not that popular. My partners are way more popular. I'm the under the radar guy. So my cell number is 917-748-0816. My email is lmartin@airvada.com. Just send me an email. If anyone has any questions, I'd really be more than happy to jump on.
Thank you so much. This was so great. I feel like so informed and excited.
Thank you.
Thanks,
All
guys.
right.
Nice meeting you, Michael.
Take care.
Bye-bye.
Nice meeting you.
Thanks for listening to Medical Morons. Don't forget to subscribe, rate, and review.